Kathy. So the City of Simi Valley's Heroin Task Force was formed very much in the same way that Santa Clarita's impetus became as well. Back in February of 2012, a parent as well as an organization that she started came to a city council meeting and talked about the loss of her child and the impact that it had, as well as the other parents that had gone through similar things. And they actually formed an organization called NOM, Not One More, with the expectation that they would do anything that they could to prevent this not happening to not one more of our children. Approximately 200 people came to that city council meeting and addressed our council. So we heard many moving statements, much like the Santa Clarita City Council did. And as a result of that, our tri-agency group met, which is our city, our park district, and our school district, to determine the best way to approach this issue, recognizing that obviously not just one of the organizations was going to really be able to get a handle on it and to be able to take all of the steps that needed to happen. So our tri-agencies met and decided that we would have 2 representatives from each of the city, the school, and the park district. And we also engaged our business community by having a member of our Chamber of Commerce serve, as well as the Not One More group. So we also have 2 parents that are dealing with this issue really on the front lines on this task force. At our most recent meeting, actually last 2 weeks ago, we also added 2 members of the faith community from our community. So we have now 2 pastors that are also serving on the task force on heroin prevention. And really, the goal of it is to identify all of the ways that we can reach out to our community to share what's going on and to educate the community. When the task force began meeting in 2012, we actually had 6 meetings last year, and we've met twice so far in 2013. The goal was really to determine what resources are already available in the community. What is the school district offering? What is the park district offering? What is the county offering? What is the city offering? And you all in front of you have this summary report on the task force on heroin. What this summary report did is it actually took all of those presentations to the task force and summarized what they were, what those resources were that were already available. As a result of those presentations, then the task force identified what the strategies needed to be in order to address the heroin issue, but really more expansively than that, the drug issue as well. So while our task force is specific to heroin, we recognize that it really is all about substance abuse in general, not just that heroin issue. So once all of those presentations were heard, then the strategies that were identified were then ranked by the task force to determine which ones really felt that needed the most attention going forward. And then a lead agency was identified for each. So we ended up with the city being the lead agency on some, the park district on others, the school district on others, recognizing that each agency would be able to implement them in a different way and use the resources that were already available to them in those ways. So for example, pretty much at each meeting since we identified what the strategies were, we've then been coming back and providing updates to the task force on what actions have been taken. So for example, in our school district, the school district was offering a number of programs for drug prevention, for tobacco use prevention, for alcohol prevention, but what was coming out of it was that a number of parents were not aware of what those programs were or the resources that were available on campus. The same goes for the programs that the city offers and that the park district will offer for programming and classes. So with these updates, what we're really finding then is we're furthering the education of what those programs and services are that are available, and then how those programs and services can be expanded. So for example, with the school district, with their Keeping It Real program, they are reporting back to us, how many students they have touched, the other programs that they're executing or adding additional assemblies, partnering with the police department to ensure that there are additional resources provided and that parents are aware of them. One of the other issues that we found really through the task force was that while there were a number of resources and programs available, parents didn't know where to look for them at the time that their family was in crisis. So at the time that they really needed them, that was the time that they were kind of more frantic. Whereas if we could begin educating the community ahead of time, then when they actually needed those programs and services, they'd know where to look and where to go. And so a lot of it really has been about reaching out more so to the community and letting them know where to go and what types of services are available. In addition to that, we've partnered with as I mentioned, the Park District. And the other thing that you have in front of you, this trifold brochure, was actually put together by our Park District. So, for example, some of the action items that they have taken, they've partnered with the city on a meet and greet for service providers so that we can ensure that we're continuing to share information and that we're all aware of the resources and services and programs that are available. So if we end up with someone in our offices, we know where to send them. The Park District has been excellent about really using the resources that they have available, such as their I think it's quarterly activity brochure that they put out that lists all of the programs and classes that they have, and they'll place ads, they'll place the list of drug resource and prevention programs in those activity brochures, and those go out to every household in our community. So something as simple as that, adding one page, is now touching all of our residents with all of those resources that are available. They're also adding additional classes that are free for parents to take. And our police representative will talk a little bit more about what our department does, but they've provided some classes as well. The city has used the services that we have available, and Summer will actually talk a little bit about that. I'll defer to her in just a moment. But we have a youth council program that puts on a youth summit annually, and they've incorporated the fight against heroin and drugs into that summit pretty much every year that they've had it. But this year there was a special focus on that. They also hosted a drug panel recently, and we've also placed some ads in our bus shelters around the community, advising people about the Not One More organization and the resources that are available. Our community also recently had some nationwide attention when we appeared on Dr. Phil with our school district, talking about the types of things that we're doing, and really addressing the fact that this is a nationwide issue and we're being affected much in the same ways that every other community is, and really trying to share what we're doing to ensure that our community will hopefully have less of an impact as time goes on. I would also say that with the heroin task force, we found that everyone that we've worked with, other cities, other communities, have been very interested in ensuring that we are sharing best practices. Santa Clarita has been a great partner and has shared some of the media that has been prepared. And as a result of the Drug Free Youth in Town program, we're actually going to be researching that and looking at the possibility of implementing that in our community as well. So it's very a heartening effort, really, because everyone is as committed to ensuring that our communities are as safe and our children are as drug-free as they can be. And I will also say, really, that everything that we've been able to do, we really have no budget as a city to do it. So we've been very creative in finding the solutions to ensure that we're trying to implement whatever programs we can and support the other organizations to the extent that we can as well. So I'll let Summer speak a little bit about what her team has been able to do with the youth services program related to the drug prevention.
And I'd really like to just echo the interagency collaboration is really the key that's made this possible. And that's why our task force itself has been essential in being an additional catalyst to that original impetus of the parents coming in. Everything has started as a grassroots effort, and throughout we've kept it that way. Our governmental agencies, our nonprofit agencies, and our community organizations have been able to step up and address these issues, but every step of the way, those grassroots parents, community members, students, youth themselves have been engaged at every level. And I think that's really what's made it successful. It started there, it's continued there, and really that's where it ends. It ends with those individual decisions that the individuals are making, and we're simply giving them the opportunities and empowering them to do so. One of the examples of that is the Youth Summit that Sam alluded to. We've been having an all-day youth conference now for over 10 years, and it's always been a collaborative effort. The city hosts it. Our youth council is a 24-member advisory board to the city council of junior high and high school students, very similar to our partnering cities. And they host it every year, but our Recreation and Park District allows us to use their facility. They allow us to use a number of their staff members to engage the youth. Their dignitaries come and sit at the table with our youth to find out directly from them what they're interested in and what are their solutions to community issues. The school district does the same, and they also go a step further in allowing it to be an excused absence from school, an educational activity, and it's included in part of their curriculum. This year, for example, we also brought in our county behavioral health, alcohol, and drug programs to that event. Straight Up Ventura County does a number of interactive programs with them. They do an comedy improv with the youth that really puts the issues in terms that the youth themselves can understand, and they get them involved and engaged up there doing the same thing. They also have a really neat video game that they have the students play, and all of the students can compete against each other and find out facts and discover what they know and don't know about drugs and alcohol. And pretty much they all come away surprised at what they've learned, as Ingrid was mentioning happened also with your Defiant program. The interagency collaboration has also helped us where the funding comes in, because as Sam indicated, none of the agencies have designated funding for these programs. So we are creating new programs and new educational outreach materials. We're doing it by each agency stepping up to the plate. We recently sent out an insert in our water bills. The city operates our water billing, and we do water billing to approximately 40,000 residents, households. The county drug and alcohol programs were able to create those inserts, provide the content, provide the information that the residents need to know to find resources for drug abuse. They focus specifically on heroin and prescription drugs in this example, and they were able to provide the printing of that, and the city provided the mailing as well as the reach. We have the customers, we have the engaged people who are having to open up their bills. So that collaboration is really what continues to take us forward. We also were able to put educational information on bus stops, and that was actually run by our community organization, Not One More. They went into our school district. We have a performing arts academy, and they went in and talked to them and had the students do a competition to decide what posters would be placed throughout the city on our bus shelters. The city has access to the bus shelters, so we were the forum for that voice, but the Not One More organization went into the schools and got our students to really be telling one another what they shouldn't be doing and why, what the effects are of that. So again, it's this interagency collaboration. We'd love to answer questions similar to Santa Clarita. If anyone has questions about any of the programs, how we've gotten to where we are in a position where we certainly feel we are not done. We are moving forward. As Sam indicated, we're researching information. I don't want to say too much for what Deputy Chief McGinty will include, but we have certainly also utilized best practices from our neighbor Thousand Oaks, and we appreciate that collaboration and the partnership there, as well as that within our own community.
I do have one question. You mentioned the Dr. Phil Forum, which was kind of a unique opportunity in a lot of ways. Did you notice anything in the community as a result of having that national coverage? Did you see an increase in engagement, awareness, people talking about the issue? Was it helpful, hurtful? What was your experience of that?
I think it was definitely helpful. There was obviously, anytime that there's any kind of national coverage, there's some contingent that feels like it draws negative attention, and then others that feel that it draws positive attention. And from our perspective, we really wanted to get the information out there, and we recognize that it's a national issue that our community is affected by. It's not just our community. And so drawing attention to that and really identifying what we're doing to address it, we found to be very positive.
Another result of that as well is that our mayor received countless communication from individuals within our community that wanted to help, that wanted to become involved from areas that we had not considered as staff. For example, we had individuals that were nutritionists step up and talk about nutrition that you can utilize when you're going through drug rehabilitation that can actually help you in your efforts. And we had additional counselors that live in our community that are working elsewhere that are doing fabulous programs that came up and said they would like to work with us. We had faith-based organizations that came to us, as well as other states, other cities contacted the mayor and said, I want to learn from you, I want to do what you're doing, or have you tried this, and are giving us ideas. So it also was very beneficial in increasing the resources that were at our disposal and increasing the opportunities to address this issue in a way that we had not necessarily considered previously.
Well, first, let me say thank you for hosting this today and inviting Simi Valley. What strikes me so far in this is that listening to Santa Clarita and knowing a little bit about what Thousand Oaks is going to present, you've noticed some pens up here and some note-taking, so there is some good collaboration taking place. I think we're doing a lot of similar things where we may just be calling it something different, is what strikes me. Specific to Simi Valley, though, Heroin, methamphetamine, marijuana continue to be the most commonly used illegal drug. And from an enforcement perspective, in response to this, we currently have one task force officer assigned to a county task force. And I won't say too much about this because the Ventura County Sheriff's Office actually runs the task force. We participate on it, so I'll let them talk about it. But it's this regional approach between Moore Park, Thousand Oaks, and Simi Valley, east of the Conejo Grade up to the LA County line. And again, I'll let them talk more about that. In addition to that task force officer, we also have two task force officers assigned to two separate DEA task forces, and they work out of the Roybal Building in downtown LA. The advantage of doing that is that we have federal resources at our disposal. They have a much bigger budget for these types of things, and some of the higher tech investigations and the equipment that is needed for these, they're able to afford it, where on a local level we just can't afford that. And so that was a huge advantage for us. We also lastly participate on a regional task force looking at dirty doctors, dirty pharmacists that are overprescribing the OxyContins and the different types of drugs that are out there. Again, that task force is run by the Sheriff's Office, so I'll let Commander Pennis speak more to that. One of the things that we did back in October of 2011, we installed a drug drop-off receptacle in the lobby of the police station. The lobby of our police station is open 24/7, and since then we've collected over 2,000 pounds of unwanted drugs from the city of Simi Valley. Yes, some of that was old aspirin, but a lot of it was probably painkillers and other things that the word is getting out. Don't leave this stuff in your cupboard because your kids are going to get into it. How many of us have had a knee surgery or some kind of a surgery and they give you a month's supply and you take them for a week and the remaining 3 weeks sit in the cupboard? You forget they're there, but the kids don't. So we've tried to attack that problem as well. One of the things that we also do, we're doing this approximately 3 times a year, and it has been the demand is very high for it. It's called the Parent Project. We have a program where we participate and we run it, and it's designed to help the parents deal with the incorrigible child, to deal with the kid who might be heading down the wrong road. It gives them some tools to work with. Again, the education component. Last year we held a public drug forum. We did model it after what the Ventura County Sheriff's Office did in the Conejo Valley, our neighboring 2 cities. And we had approximately 300 plus people in attendance to that. That was we thought it was a very successful event. Again, it's bringing awareness to the problem. That's what the Not One More Group's probably most significant contribution is bringing this awareness to the problem. My neighbor across the street, an educated individual, came up to me the other day and said he had finally read the Acorn newspaper that gets thrown into his driveway every Friday. He finally read it for the first time in how many years and said, I didn't know we had a heroin problem in Simi Valley. We got a little bit more work to do. I think there's a lot of people that are shocked. Simi Valley has a reputation of being a low-crime community, and so when people hear these things, they're just absolutely taken back by it. So we have a little more work to do in that regard as well. We also have a stop trailer, and I believe this was modeled after something that the LA Sheriff's Department did. I think it started over in your Malibu station, if I'm not mistaken. It's a trailer that has it's a visual impact device. It has a smashed up car in it that was a result of a traffic collision. We take that to the schools and we try and, through the visual impact, tell the kids this is what can happen if you become under the influence and then choose to drive, whether it's drugs or alcohol, either one. And we've had some pretty good success with that. In addition, to supplement that, once every year for 11th and 12th graders, and we alternate it between the east and the west end of the city. So every student in the Simi Valley School District right now, before they graduate, they might get it in 11th, they might get it in 12th grade, but they go through the Every 15 Minutes program, which is about a 2-day-long program that has a lot of different components to it. And again, it's to kind of go after the emotional impact of what happens when somebody drives under the influence, crashes a car, and somebody ends up dead. Similar to, I heard the Los Angeles Sheriff's Office talk about combining some resources. We recently combined our school resources officers with our youth services program. Our youth services program is Essentially, I would describe it as a local diversion program. We have about a 90% success rate since this has been in play. These are for minor offenders. They have to be under 18, obviously. It's only for juveniles, and 90% of them have never reoffended, either going through the program or after the program was over. So we feel that that's very successful. Our youth services officer supplements the 2 SROs that we have. We have 1 SRO assigned to each of the primary high schools. There are 4 high schools in Simi. 2 of them are quite large. One is kind of a magnet setup that has about 1,000 students. That gets attention from the SROs. And then we also have a continuation school that has a few hundred students that also gets attention. Probably the biggest problem locally as far as enforcement goes is the ease at which heroin can be obtained. There was a man who's a reporter for the Los Angeles Times. His name's Sam Kionis. I don't know if anyone's heard of him. And back in 2010, he wrote 2 articles where he described what's going on with these small amounts of heroin that are coming into predominantly white suburbia USA. And he specifically focused on this area initially and has since gone across the country and points out that this same problem is occurring in Charlotte, Boise, Idaho, Reno, Nevada, and so on. So this isn't isolated to our area. But what's happening is, and with the arrests that we've made, we've been able to confirm that this guy seems to know what he's talking about. He's done a lot of research on the topic, and most users in Simi Valley would be able to, just through the connections that they make because of the friends they're hanging out with, dial an 818 number and get a $20 balloon of heroin delivered to them. Now what that does that's different than how it used to be, some 20-year-old user in Simi Valley might be very intimidated to go to the Van Nuys to an alley off of Sepulveda Boulevard to try and buy $20 worth of heroin, something that they have to do sometimes when they're in maintenance to do it twice a day. But to be able to call 818 and have it delivered to you, the ease is just there. We've interrupted a couple of these delivery services that were coming into Simi Valley. Our problem that we find is as fast as we can interrupt the service, another one pops up. There's an endless supply of people that are willing to participate in this. So that continues to be probably our biggest enforcement struggle is this. We've referred to it because it actually does kind of tell you what's going on. It's a pizza delivery model. As fast as you can order a pizza in Simi Valley, if you know what number to call, you can get $20 worth of heroin delivered to you. That's a problem. Statistically, very briefly, I'll talk about Simi Valley. We make approximately 15 to 20 heroin possession arrests each month. That is up 15% over the same period last year. So we're trending upward when it comes to the possession arrests. And we are, within our system, able to break out heroin specifically. So we know our arrests are specific to heroin. It's not mixed in with cocaine arrests and other different types of prescription medications. The overdose deaths in Simi Valley peaked in 2011 with 7, and that was the same year that the folks showed up at the city council meeting that Sam talked about. There were almost 350 people that attended that meeting with about 20 speakers, and they were pleading for help from local government to try and address this problem more aggressively than we had been doing. Year to date in Simi Valley, since January 1st, 3 people have died from heroin overdoses. Demographically, 75% of all the heroin users in Simi are white males, and they're between 18 and 31 years old. Questions at all?
Yeah, actually I do. I had a couple of questions for you. One of them, since you just talked a little about statistics, is I was looking over the brochure that you passed out and noticed that 49% or almost half of all of your heroin-related arrests are for the age group of 21 to 25. And so, and maybe this is, it's probably similar, I would guess, to all three areas. It seems like it's a difficult demographic to reach. So how do you categorize the amount of effort you spend trying to get to the individuals, the youth, before they get to that demographic, or how much effort and time and programs are focused on that actual demographic, which makes up half of where the arrests are actually coming from?
Yeah, I think one of the things that everybody needs to realize is that nobody graduates high school and decides to start shooting heroin. There's destructive behavior that's going on at the earlier years, maybe as far back as middle school perhaps, or even grade school. And so I think you have to really attack the problem through some of the prevention programs that we're talking about within the schools. because once someone's already 21 and they're using, it's too late. They're going to have a rough time getting over that. Even so much so that some of the deaths that have been reported in Simi Valley are actually people that have gone into rehab and come out and relapsed. And what happens is when they relapse coming out of rehab, their body has lost the tolerance to the amount of heroin that they were used to using, and they actually overdose themselves accidentally, and they don't realize what they're doing. And so here's somebody that went into rehab and still dies as a result because they relapsed. So it's very difficult dealing with that age group, trying to get to them when they're already using. I think the solution longer term is to get to the groups before they get to that age group.
And if I could echo and add some of the prevention efforts that the police department is really pivotal in, they have a parent project as part of their diversion. They have, for parents to go through where they're having difficulty with children, they have a support program to go to. In addition, as our Rancho Simi Recreation and Park District has implemented parent education courses, so we're really targeting parents in a lot of ways. We also borrowed best practices from the city of Thousand Oaks. We recently had a reality party. We had that in our community a few years back, but we brought it back again by a community organization, Community Coalition United, coming to us and saying that they were looking for police department involvement. Our police department also has had a number of community forums where they've talked about the dangers of drug abuse. They've gone into the prescription drugs that Deputy Chief McGinty indicated, as well as the other issues with bath salts and things like that, and getting the word out about don't run, call 911, and the new information that's come forward and new opportunities. We also are partnering with our nonprofit organizations as well. For example, we have a health clinic in town, the Free Clinic of Simi Valley, and every year they have an annual fitness and health expo. And really what you're talking about are preventative efforts there, early intervention and prevention again, rather than unfortunately, once it's further along. So the city has approached them and asked if we can expand their program to include a number of drug and alcohol resources as well as prevention efforts. Rancho Simi Recreation and Park District, YMCA, Boys and Girls Club, activities that our youth can become involved in before they're reaching that point to divert them previously. In addition, we also have strong engagement with our nonprofits. Every year we hold a youth services meet and greet, which includes over 50 organizations, the school district, the tri-agencies, but also a number of nonprofits, county agencies that provide services in our own community. And we discuss each year topics that are addressing our communities and how we can come together to collaborate on those. And again, our police department is essential in identifying what those issues are that a number of our organizations are facing. In addition, our police department has been partnering even closer with our school district on their canine searches and canine efforts and bringing those into the schools. We've been welcomed into the schools, which has been much more friendly partnership than we've experienced in the past, and it's been having great results, so much so that they keep putting pressure on the department to provide more. The community wants additional enforcement in the schools and additional support there, as well as the school resource officers, the SROs that Deputy Chief McGinty referred to earlier.
We have 3 canine officers in Simi where the dog is cross-trained on not just patrol but also narcotics detection. We train with a number of other agencies and we'll partner up with them as often as practical. It's sometimes tough to schedule these things, but we will go into the schools. We will let the principal know a couple of hours in advance, and that's the extent of the notification. We go in when the class is in session, so the dog is not around, because they are patrol-trained dogs. We do have to be a little bit careful so that the dog is not around students that are moving from class to class. One of the things that we expanded on that program, we've been doing this for years, but one of the things that we expanded on was we got permission from the school district because we are operating on their turf, so to speak. So we got permission from them that we randomly went up to some classrooms, interrupted the class, told everybody to leave their knapsacks, book bags, personal belongings, and so forth on the floor, and please exit. And the dog has gone through and sniffed all that. We have made a couple of arrests, not very many. Not very many. From what our SROs tell us, the vast majority of kids that are bringing things to school, they're going to hide it in the bushes on you. and they're not going to keep it in their possession so that they don't get caught with it. Obviously, they don't keep it in their locker. It could be in their cars, but that presents a whole nother problem trying to deal with the parking lots, both teachers and student parking lots.
John, I'm just curious, is there any of the schools that have drug testing on campus?
No, and that's been discussed pretty extensively. That's why I asked the question that I did earlier about, there was some testimony in front of the Heroin Task Force a number of months ago where it was an attorney that came in and explained the legal issues regarding drug testing students. We were told that a student who elects to participate in something other than just going to school, so the football player, the cheerleader, someone who's on the speech and debate team, whatever it might be, can be mandated as a result of participating on that to be tested. Our school district has elected not to do that.
You get much flack back about the drug dogs. We've had the drug dogs here before. We had a contract for a long time. A lot of people felt strongly that it was a great deterrent because the kids never knew when the dogs would show up. Other people have felt like the level of disruption to the academics of the day made it not worthwhile, and the fact that they really didn't come up with that many arrests. Usually they had a lot of, the dogs actually prompting that something was there and there wouldn't be in the backpack anymore. It might just have had the smell of marijuana or whatever. What has the community's reaction to that?
I think the community in Simi Valley has developed a tolerance to the program, if you will. I do believe there's good support for it, and you're right, we don't come up with a lot of arrests. It's a lot of manpower, but the practical side of it is it's a deterrent because you don't know when we're coming. And I think that's the real value of it. But as far as community support for it, we have not had any complaints, not on any large scale anyway. And the school district has been supportive of it. And over the years, we've been able to expand the scope of each one of those searches.
The Canary Valley Unified School District contracts with a private canine company to do the searches. So the sheriff's office isn't involved. They contract out.
That's what we had before, was a contract, and then we just ran out of funding, and we tried to do it a different way, and it didn't really work very well. So it's one of those things that I continue to get calls from service providers trying to see if we're interested in engaging that service again. But we've had a lot of discussion back and forth of really the validity of it and how much of a deterrent is it or isn't it, et cetera. And so it's kind of just always on the table.
Well, we have found in Canary Valley Unified that when the dogs get there with technology, every child on that campus knows the dog's there from texting each other. And it hasn't been very effective. Again, they contract with somebody else, but that's what the kids tell us and the teachers.
That's a little bit of the information that we were getting as far as feedback. And I do have one other question, if I might, about one of our issues, I think, is really getting our parents involved. I mean, that seems to be a weak link for us, is when we offer something, a lot of the parents who come are not necessarily the parents we're hoping to reach. It's being able to get those parents that we feel like need the education awareness to come. Can you tell me more about your parent project as far as how you identify these incorrigible kids and their parents, and what the program is you offer them and how you get them into it?
That's not how the program actually works. The program is open to anybody in the community that feels they have a personal need to educate themselves on and acquire some tools on how to deal with a child that they've already identified within their home. We don't identify the child first and then invite the parents. One of the things
And they just call the sheriff's department?
We have like an open enrollment they can call the police department. We advertise it a month or so, 6 weeks in advance, and we have had no problem filling all the seats. So it has been pretty successful. Now, one of the things that we have done is with our SROs is, because we try and take advantage of that captive audience, is some of these back-to-school nights where we've talked to the parents. But even still, some of the parents that probably need to hear it the most aren't in attendance.
So they come and it's led by, who leads it? Where's it held at? How long does it last? Right.
How long does it last? I want to say it's 10 weeks. They meet once a night for a couple of hours. We host it at one of our local churches, open their doors, so we were able to do it at no cost at one of their adjacent rooms. And it's taught by, there is and I can get you the information if you'd like, there is a training program that we've sent our people to attend so that they present the material in such a way that it follows the guidelines of the program.
I'd like to see that if possible.
I'll be
Thank
happy
you.
to send that to you.
Just through
It's a
the
national model.
yeah, just
Go
through
ahead.
theparentproject.com, you can look through there. They have the training sessions about 4 or 5 times a year that you can send people through to be facilitators. In the Conejo Valley, we've also been able to partner with our school district. They've started a new program, the Breakthrough Program. Any hurdle to any type of learning, so whether it is behavioral based or it could be drug based as well, the students are referred to this program. Through that and partnering with them, we've been able to go through, make some presentations, and get some parents, maybe more of our targeted individuals that we're looking for with in the parent population, to get them through the program, and then also working with our school resource officers, students that they may deal with, trying to promote our Parent Project program through them. And we've had great success in increasing our numbers within the Parent Project.
Great, thank you very much.